tell how swollen my limbs are. This leg is so swollen that it's bleeding and with open wounds. Hi, what's today's date? The 16th, 15th. Today's October 15th. And I'm showing the progression of my legs. If you can pan down, please. If you'll notice, the right leg ulcer is getting smaller, improving. The whole leg looks better. And then coming to the left leg, you'll look all the way around and you'll see how that ulcer over there is getting worse. Not better. Boom, all through there. So I need a lot of work on these legs. Both of these legs still, of walking and leg lifts, keeping the legs above my head and keeping the circulation going, and losing weight. It's the only two things, the circulation and losing weight, is what's going to resolve the matter and resolve it permanently. Otherwise, these ulcers will continue to open up, lesion, spread germs, bacteria, get infected, and eventually I'll lose the legs. So please continue to watch the other workout videos as I make them. Hopefully they'll help improve your life as well. Thank you. You can tell how swollen my legs are, and an open wound on the right leg. The other leg is swollen as well. Officially called edema. And the swelling causes wounds like that because there's too much liquid, too much water, not enough circulation. So my legs need much improvement.
I was curious as to, like, obviously there's some sort of viscous fluid coming out of your leg ulcer.
Mm-hmm.
That's what the napkin symbolized. Do you know why that is?
The blood in my system, gravity has drawn the blood down. But the heart alone cannot bring the blood back up. It needs the calves to act to. The calf muscles they're the secondary heart. They help pump the blood. And me laying down at night, if I were to lay down longer, that would be less of a problem. So what's happening is the legs are swelling from all the blood. The blood then pulls and the water starts to seep out, then thusly ruining the wall lining of the skin, creating an ulcer, an open wound. The skin can't it's too much water for the skin to be skin.
It like seeps through the skin.
Right.
Whoa.
It cries. The skin cries.
Wow. Because when you look closely on the other leg, it was kind of scabbing a little bit.
The scab is healing. It's now scabbed over. It's no longer an open wound directly. And usually, scabbing is a good sign, especially if the wound's getting smaller. There's been times I've had to. There's been other times I've had other similar leg ulcers that I've had to go to a specialist, not just a doctor. The doctor couldn't fix it. I've had to go to a wound clinic with specialized doctors to pick up the wound, clean it up, get rid of the infection so the wounds can heal. I'm now having to go to a vein specialist who's going to recommend that I get some sort of surgery, some sort of surgery on the veins because the veins are starting to expand and not pump up the blood very well either. So I'm having multiple issues here, but the main issue is the fact that the blood's pulling. It's too much water on the skin because it's too much blood. So the blood has to go somewhere.
So is this is like the solution to help with the healing, to turn yourself upside down so that the blood will rush back up into your upper section, rather like into your legs?
Yes. So, what you're asking me, the workouts that I do, will they help? Yes. According to the regular doctor, the specialized doctors, and the rehab specialists that have worked with me on these particular wounds.
Well, how do you feel about them personally?
They recommend I do all the workouts that I do. I feel fully legit that I'm doing the right types of workouts to well the moral of the story, these keep coming back. I get them to go away, they get better. I get a little lazy, they come back. The moral of the story is that I need to lose weight. I'm a fat ass that needs to lose weight. And when I become normal size again, you have to remember I'm 370 pounds right now. When I become normal sized, under 300, under 270, 280, 270, once I become normal sized, and I'm still going to be overweight then. But once I become a more legit size, these ones will disappear forever. It's the matter of fact is that I'm fat, I'm obese, and old. Period, man. That's why these ones are coming along.
So this is a really heavy question.
That's a fat joke. Heavy question. All right, go ahead.
And how much longer do you? Well, it's kind of how much longer do you think you're gonna live, and how much life do you think that you're fat? How much life to your lifespan do you think your fatness is gonna take away from you?
Life. That's a
Like
difficult question to answer.
you get a certain amount of time, you know.
Right. So, each day that goes by is another day that I'm more likely to lose my legs. No. Will that take my life? No. But it will certainly go to discriminate against the quality of life that I'm looking for. I want my legs. I was born with them. I want to walk around.
Walking around.
Walking around is important to me.
I like that too.
So, people view life differently. I'm not trying to get into religion or anything like that. Being fat, obese, and then losing my legs, not only would that hinder my quality of life, I'm a lot more likely to die sooner due to infections or lack of exercise or, can't walk anymore. So basically, I have to walk every day, and I gotta use these ski poles and walk around with ski poles and stuff to help lighten the load a little bit as I walk along. So it's pretty cool. And so walking is going to activate um, that calf muscle, which is going to act as a pump, a secondary pump. Every time I activate that calf muscle, pump. So it's good. It provides circulation.
Yeah, we got to get some footage walking around and stuff. Just, I'd be curious just to ask you like what you're going through and like how you're feeling about walking, because I can imagine that like at the beginning it would be really exciting that we're motivating to
Right.
like,
And so
improve your life.
and so I've come a long way. I weighed as much as about 470 pounds. That was about approximately 100 pounds ago. And so I was just starting to deal with neuropathy, which is the nerve endings. And so I'd walk along, ow, 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 it hurt. Every time I took a step, it hurt. And so I get done with my walk, and I couldn't wait to get home because my feet hurt from the neuropathy. The neuropathy has all gone away because of the circulation's coming back and the weight loss. So another issue is that I have a bad knee and a bad ankle, and it hurts to walk. But I'll get some footage of me walking, hopefully around town and stuff. And
Yeah,
I don't go real far, real fast, but
it could be an incredible change
um,
of lifestyle. And
right,
maybe some people need that like really drastic, complete makeover,
right,
overhaul of your lifestyle. Is sometimes you just gotta ease into it,
right.
or we
So
just
so I apologize for not having started some of these feelings earlier in my descent from quality of life into a super fat ass, so to speak. I was super heavy. I was almost I was really close to 500 pounds at one
Chinese
point in
people
time.
really like fat people. So
And I'm pretty happy with as far as I've come the past year, but I got a long ways to go. So I hope you guys tune in again and start getting some of your friends active and exercising to improve their life. These people need it as much as I do. So thanks for asking me questions.
yeah,
Thanks for tuning in to this episode. Please feel free to hit subscribe at the bottom and ask any questions you want. Thank you.
cool.